Bismillahirrahmanirrahim. Assalamu alaikum to all. I am Ayesha, student of Bachelor of Eastern Medicine and Surgery from Hamdard University, Karachi. The title of my research is Qualitative, Comparative, and Natural Thematic Analysis of Trachyspermum ammi seeds in Dysmenorrhea. The background of my research is my 2 years past observation that many female students skip their classes and even absent from university due to severe pain during menstruation, which is a common gynecological condition which required medication to get relief, and that is medically known as dysmenorrhea. It is highly impact the quality of life of a female. To resolve this condition, I researched and got a natural drug in the form of herb Trachyspermum ammi seeds, which is commonly known as carom seed. Mostly grown in Pakistan, its temperament is hot and dry. It is safe to use even at higher concentration. It is commonly it contains potent analgesic property and phytoestrogen. It has a also prostaglandin inhibition activity, which was later discussed in discussion portion. Prostaglandin is responsible for the pain during menstruation in primary dysmenorrhea. The aims and objective of my study is to evaluate the effects of Trachyspermum ammi in the patient suffering from dysmenorrhea and the symptoms associated with it, and also compared with the other medications used by the patients in dysmenorrhea such as ibuprofen and paracetamol. These three things are concerned with the aims and objectives of my study. The methodology of my study consists of two major steps. The first thing is the preparation of Trachyspermum ammi seeds decoction, and the second step is the parameter from which the effects of Trachyspermum ammi seeds was evaluated. In the first step, the preparation of the decoctions contains three steps. First is weighting the 3 grams Trachyspermum ammi dry seeds, boil it into 200 ml of water, while it reduced into 150 ml delivered to the patient. In the second major step, the parameters from which effects of Trachyspermum ammi seeds was evaluated, it contains three major points. The first in how much time period from which patient get relieved. In the second, in within 24 hours, is there any kind of adverse effect of the drug or the relapse of the disease was occurred or not. In the third step, the Trachyspermum ammi seeds results compared with the effects of paracetamol and ibuprofen. The data analysis shows that 49 out of 50 patients get relief from the Trachyspermum ammi seeds decoction, while only 32 patients get relief from paracetamol and 39 patients get relief from ibuprofen. The comparison of time shows that Trachyspermum ammi give results in average 8 minutes, while paracetamol gives results in 42 minutes and ibuprofen in 36 minutes. The results also shows that there is no any kind of adverse effect was seen while delivering the Trachyspermum seeds decoction to the patient, like hypersensitivity, nausea, abdominal cramps, headaches, excessive bleeding, and excessive uterine muscles contraction. With this, there is no any kind of relapse of dysmenorrhea also not occur by the Trachyspermum ammi seeds. While the paracetamol only resolves the uterine pain and the headache, and by the ibuprofen, some patients get adverse effect like diarrhea and abdominal bloating after received ibuprofen. This comparison study shows that the Trachyspermums have a very potent activity in dysmenorrhea. The discussions here shows the mechanism of the uterine pain. With this, the how Trachyspermum ammi acts on this dysmenorrhea. As due to regression of corpus luteum, progesterone is released and it begins the menstrual flow occur. In this, prostaglandin, high ratio of prostaglandin release, which cause increased myometrial contraction and reduced blood flow, which cause pain, excessive uterine activity, uterine ischemia, and sensitization of nerve terminals to prostaglandin. The Trachyspermum ammi modulates the uterine activity because it contains phytoestrogens. The natural estrogens modulate the uterine activity. With this, it has also the property of calcium channel blocker. It also blocks the calcium influx into the extracellular fluid, which both activity relax the smooth muscles of the uterus. With this, it also relaxes the large intestine, which is responsible for the diarrhea during dysmenorrhea. It also, because it effect on the smooth muscle cells, it also dilate the vessels, which inhibits the uterine ischemic condition by improving the blood flow. In the third activity, the Trachyspermum seeds also shows that the platelet aggregation it inhibits. It inhibits platelet aggregation by inhibiting arachidonic acid. Arachidonic acid is also responsible for the production of prostaglandin, and which is, as we see above, that prostaglandin is become the actual responsible for the increased myometrial contraction and ischemic condition. It also acts as an anxiolytic activity. As in the patient of dysmenorrhea, we commonly observe that the anxiety is increases in such patients. The thymol in the Trachyspermum ammi seeds act on GABA A receptor and give the effects of anxiolytic. While we see the paracetamol and ibuprofen, it just inhibit COX pathway and inhibit the production of prostaglandin by inhibiting COX pathway. But the Trachyspermum seeds have countless pharmacological properties. Especially, it also gives antiemetic property, as in dysmenorrhea it is an associated complaint. It also acts as antidiarrheal, anti-anxiety, and which cure the associated complaints of dysmenorrhea. The conclusion of my study is that the dysmenorrhea improves the quality of life of a female because it is a natural and safe. With this, it is orally active. While it is given into decoction form, it gives result within only 8 minutes, average 8 minutes. It strongly and shows a strong anti-nociceptive activity and smooth muscles relaxant by dilating vessels, by relaxing uterine muscles, by relaxing the large intestine, which stops the diarrhea condition. The results also justify that Trachyspermum ammi has more quickest and safest effect than paracetamol and ibuprofen used in dysmenorrhea by the patient. Thank you.